Question number 20. Radiographs show collapse of LT vertebral body, which is encroaching upon the spinal canal. Through the remaining right vertebral body, there is diminished density of the central trabecular bone, related preservation of the cortex, and thickening of the marginal trabecularium, which appear coarse, most likely underlying condition of bone breakage disease. Radiographs show collapse of LT vertebral body, which is encroaching upon the spinal canal. Throughout the remaining right vertebral body, there is diminished density of the central trabecular bone, with relative preservation of the cortex and thickening of the marginal trabecularium, which appear coarse, but is the most likely underlying condition of bone breakage disease. Collapse of LT vertebral body encroaching on spinal. Okay. Important is that there is coarse trabulations, breakage disease. 2021. People with increasing short-term memory problems. Perfusion sonography study of the brain shows reduced perfusion in the posterior parietal region, bilateral hemorrhagic diagnosis, Alzheimer's disease. Patient has short-term memory problems, and then there is reduced perfusion in the posterior parietal region, bilateral diagnosis, Alzheimer's disease. 22. Breakage disease shows coarse trabulations. Which is the most sensitive sign on John's contrast CD for detecting early hydrocephalus in large temporal horn of the lateral ventricle? Most sensitive sign on the non-contrast CD for detecting early hydrocephalus in large temporal horn of the lateral ventricle. Most sensitive sign on non-contrast CD for detecting early hydrocephalus in large temporal horn of the lateral ventricle. Question 23. MRI, only abnormality seen on high signal in the posterior portion of the thalami bilaterally on T2W after images, most likely condition variant fluid Jacob's disease. MRI only abnormality seen is high signal in the posterior portion of the thalami bilaterally on T2W and clear images, most likely condition variant fluid Jacob's disease. 2024. Sacral aneurysm is identified. From which of the following variant Jacob's disease? There is a high signal in the posterior portion of the thalami bilaterally on T2 and clear images. High signal in the posterior portion of the thalami bilaterally on T2 and clear images, so diagnosis, variant Creutzfeldt Jakob disease. 24. Sacral aneurysm is identified. From which of the following locations in the cervical oblique the aneurysm most likely to arise? Junctions of anterior cerebral and anterior communicating artery. Sacral aneurysm is identified. From which of the following locations in the cervical oblique the aneurysm most likely to arise? Junctions of the anterior cerebral and anterior communicating artery. 25. Clinical diagnosis of stroke. On AMCD shows rounded area of lower in the right posterior frontal lobe with local cranioform spanning sulcate basement. History of lung resection from malignancy 18 months previously. Therefore, image investigation would you perform next? Contrast NMCT of the brain. Clinical diagnosis of stroke. On AMCT shows rounded area of lower in the right posterior frontal lobe with local cranioform swelling and sulcate basement. History of lung resection from malignancy 18 months previously. Which of the following image investigation will perform next? Contrast NMCT of the brain to differentiate between recurrent lung cancer or stroke. We do contrast NMCT of the brain. 26. Numerous masses in the neck bilaterally. CT scan shows multiple lymph nodes that enhance peripherally and contain areas of calcification. A cardiac lesion is noted in the right lung apex, most likely diagnosed tuberculosis. There are numerous masses in the neck bilaterally. CT scan shows multiple lymph nodes that enhance peripherally and contain areas of calcification. A cardiac lesion noted in the right lung apex, most likely diagnosed tuberculosis. The hint says that there are multiple lymph nodes enhance peripherally and contain calcification, and there are also cardiac lesions in the right lung apex to diagnose tuberculosis, primary tuberculosis. 27. Man with one Hippel-Lewandowski syndrome. Seat of the brain shows abnormality in the posterior fossa. Were most likely finding cystic lesion with an enhancing mural nodule. Man with one Hippel-Lewandowski syndrome. A seat of the brain shows abnormality in the posterior fossa. Most likely finding cystic lesion with an enhancing mural nodule. Hemangioblastoma. The cystic lesion with enhancing mural nodule in the posterior fossa means hemangioblastoma seen VHL. Question 28. Which of the following location for iron deposition is pathological in 60-year-old man and may indicate onset of dementia? Putamen. Which of the following locations for iron deposition is pathological in 60-year-old man and may indicate onset of dementia? Putamen. Okay. Dementia. Iron deposition in putamen in 60-year-old man is means of dementia. Question 29. 85-year-old female with lower back pain, radiograph of generalized lung reduction in bone density. A man with symmetrical bilateral linear areas of signal abnormality in circle LA, They are low seen on T1 and high seen on TMAs, with the most likely diagnosed interference factor. 85-year-old female with lower back pain, radiographs of generalized reduction in bone density, compared to symmetrical bilateral linear areas of signal abnormality cycle LA. So Honda sign CNN, interfering factor. Honda sign CNN, interfering factor. 30. With a foreign finding features favored are regarded to the business sinus fistula, a diagnosed or grave disease lymphoma or hepatocytoma, the layer superior ophthalmic pain. In cardiac cavernous fistula, there is dilated superior ophthalmic pain. In cardiac cavernous fistula, there is dilated superior ophthalmic pain. In cardiac cavernous fistula, there is dilated superior ophthalmic pain. Question number 31. CT scans will identify multi-lobe layer isodense mass within the fourth ventricle containing areas of punctate calcium. Mass is seen to extend out of the form of Lichtenstein to cerebral angle with hydrocephalus, most likely diagnosed ependymoma. Ependymoma. A CT scan will identify multi-lobe layer isodense mass within the fourth ventricle containing areas of punctate calcification. The mass is seen to extend out the form of Lichtenstein to cerebral angles with hydrocephalus, most likely diagnosed ependymoma. 32. Biochemical tests show lower levels of aryl sulfatase, amide to symmetrical confluent areas of high signal T2 images, having periventricular and cerebellar white matter, causes callosum and corticospinal tract with sparing of the subcortical glue fibers. The periventricular abnormality shows a striped trigod pattern, most likely condition metachromatic leukodystrophy. Now this trigod pattern seen in metachromatic leukodystrophy, and leopard skin seen in adrenoleukodystrophy. So there's and metachromatic leukodystrophy that also sparing of U fibers. These fibers are spared, and in this there may be involvement of U fibers with adrenoleukodystrophy. The involvement of U fibers, there is complete sparing of U fibers. Question number, describe this. There is symmetrical confluent areas of high signal on T2 weighted affecting the periventricular and cerebellar white matter, corpus callosum and corticospinal tract spraying of the subcortical glue fibers. Periventricular abnormality shows a trigod pattern, with like diagnosis metachromatic leukodystrophy. 33 signs suggesting an acute middle cerebral artery infarction. See brain, the basal ganglia obscured, reduced perfusion, three of the following versus the sign, and ventriculostriate arteries. The signs suggesting acute middle cerebral artery infarction. See brain to the basal ganglia obscured, reduced perfusion, three of the following versus the sign, and ventriculostriate arteries. Acute middle cerebral artery infarction. See brain, the basal ganglia obscured, reduced perfusion, three of the following versus the sign, and ventriculostriate arteries. 34. CT scan is 3 hours after the onset of signs suggestive of ischemic stroke. These are most likely to reveal the early CT changes with 8 HU and 732 HU. After a stroke, we are most likely to reveal the early CT changes with 8 HU and 732 HU. 35. MRI shows a thin cleft containing CSF extending from the right lateral ventricle to the cortical surface of the right frontal lobe. The margins of the cleft are opposed and lined with heterotropic gray matter. The atropolymicrogyria, with a sort of cortical formation is described. This is encephalitis. This we have done before also, this is repeated. Question 36. Catheter angiogram for giant anterior communicating artery aneurysm. Soon after the procedure, the patient experiences excessive nausea. Small bright focus is seen in the cerebellum on T2 MR images. The most likely explanation, embolism of the vertebral arterial plaque. So, catheter angiogram for giant anterior communicating artery aneurysm is done. Soon after the procedure, patient experiences excessive nausea and small bright focus is seen in the cerebellum or T2 MR images. Most likely explanation for this is embolization of the vertebral artery plaque. Catheter angiogram for a giant anterior communicating artery aneurysm. Soon after the procedure, patient experiences excessive nausea. Small bright focus is seen in the cerebellum or T2 MR images. Most likely explanation, embolism of vertebral artery plaque. 37. Which additional MR characteristic of these lesions is likely to suggest progressive multifocal leukoencephalopathy or HIV encephalopathy in involvement of subcortical U fibers? These subcortical U fibers are involved in progressive multifocal leukoencephalopathy. In progressive multifocal leukoencephalopathy, subcortical U fibers are involved.